Okay, hello everybody. Welcome to the Tuesday edition of Video Clips. A couple of announcements first. Last week on Video Clips I was talking about, or maybe it was a couple weeks ago, I lose track of the time, the measles epidemic, and I erroneously said that the U.S. Vaccine Court paid out $3 trillion, and it's $3 billion. You know, when you're talking about federal money, trillions and billions, it all just kind of boggles my mind. It's so far away from the way I live my life and the numbers I deal with every day, but anyhow, I wanted to correct that. Couple of great announcements. Chef Dell has created a personal chef certification course that you can do through distance learning, which starts in March. And if you do that and the Food Over Medicine certification course together, you get a couple $100 off. So that's a great opportunity. And then a couple of things coming up that I think will be interesting to many of you. Some of you have heard about these great dinners that we do in Columbus where people can come and learn more about Wellness Farm Health and enjoy a great meal. Well, if you don't live in Greater Columbus area, I can't help you enjoy a great meal long distance, but I can allow you to participate in the same really great interactive discussion that we have about health-related issues. So on February 19th, that's what I'm going to do. Once a month, and maybe more often as this picks up some steam, I will offer our intro session in an interactive conference call format, send you slides in advance, and give you an opportunity to know more about what we do here and some ways in which you can get involved in the great work that we do. And then on the 26th, I'm doing one for health professionals who might be interested in joining our network. So if you want to talk about any of those things, call our office at 614-841-7700. All right, a couple great topics to talk about today, and one of them is Alzheimer's disease. And according to a new study, eating large quantities of animal foods cooked at high temperatures is linked to an increased risk of Alzheimer's disease. How this was determined was French and American researchers analyzed dietary data from cohort studies, estimated the amount of advanced glycation end products, we're going to call them AGEs in this broadcast, in the diets of subjects, and then compared them to the incidence of Alzheimer's disease. Those eating diets with higher quantities of AGEs had a higher incidence of Alzheimer's disease. Those with lower intake had a lower risk. Now, the formation of AGEs is a natural part of metabolism, and in small amounts they're not too harmful, but dietary AGEs result from cooking foods at high temperatures, particularly animal foods. And how they contribute to disease is they bind to cell surface receptors or cross-link with proteins in the body and alter their structure, which contributes to higher levels of oxidative stress and inflammation. The researchers reported that meat was the biggest contributor to AGEs in the diet, followed by vegetable oils, believe it or not. That's why we tell you get the oil out of the diet. Cheese and fish, those are the top four. They also stated that foods like grains, fruits, nuts, and vegetables, including starchy vegetables, very low in AGEs and don't contribute much to the total. Concluding that dietary AGEs appear to be important risk factors for AD, Alzheimer's disease, the researchers also noted that previous studies have shown this same relationship between AGEs and Alzheimer's disease. They pointed out, however, that other factors could be responsible because when you look at the foods that are high on the list, like meat and cheese and fish, they're also high in dietary cholesterol and fat, which has been linked in studies to Alzheimer's disease. So this is consistent with a lot of evidence, not the only study. The researchers did say it would be a really good idea for more research in the area of preventing Alzheimer's disease with diet, which I am all for that. I don't know if you know people who have been through this before, but millions of people in this country and around the world have Alzheimer's disease, and their families and caregivers are in just as much pain. It's financially devastating. It can destroy the quality of not only the patient's life, but the people charged with taking care of him or her. And I'm all for looking at how we can prevent it. And Alzheimer's disease, like so many other conditions, well, more of what we call those food-borne illnesses. All right, so while we're talking about diet and Alzheimer's disease, let's back up and talk about diet and lifestyle and how to make changes stick. And I'll just start by saying I've never been a fan of New Year's resolutions, and one of the reasons is that by mid-February, which is where we are right now, most people have forgotten about them. And so I tell people the best time to make a resolution, if we even want to call it that, is today, tomorrow, sometime, right now. Now is always the best time. And to make plans for permanent change rather than some short-term heroic effort, which is kind of what New Year's resolutions tend to be in many cases. Well, according to a government website, some of the most popular New Year's resolutions are the right things: losing weight, exercising more, eating healthier foods, managing stress, taking a trip, and drinking less alcohol. Studies show, however, that in spite of what we would assume are good intentions, 25% of the people who make those resolutions immediately break them, and by the end of 1 month, 50% totally forgotten about it, moved on about their business. So, whether you stated the desire to change soon, change some things on New Year's Eve, or whether it was just recently or you're starting right now, there's an obvious issue of how do you take a decision to make a change and turn it into a life's plan. Well, success may mean that you start with realistic expectations, and there are actually two aspects of this. The first thing has to do with how long it takes to make a change. I have heard repeated a lot of times that it takes about 30 days to make a change. Well, some studies show that it actually takes longer. One research group followed 96 people who chose a new eating, drinking, or activity habit to change for 12 weeks. The subjects reported every day whether they felt they were able to perform the new habit and how familiar or automatic it felt to them. For these subjects, it actually took 66 days for them to report that it felt automatic and normal to them. So over 2 times what was maybe expected. But this is important too, just as important. The researchers reported that making mistakes didn't really matter as long as the subjects got back on track right away. In other words, it can take longer than you think it's going to take. And perfection isn't the issue. Commitment to continually try and working at it seems to be part of the magic formula for getting stuff to stick. Now, I've worked with people who want to make change in diet and lifestyle habits for almost 20 years, and I am the first to say I'm not an expert on behavior. That's for other people to be experts in. But I've observed a lot of people, and I think I have gathered up a list of some common habits and thinking patterns and characteristics of people who change for permanently over time. One of them is they have a real strong reason for doing it. And I think you have to stay in touch with your why, or this just turns into more chores at some point in time. Well, I got to make a salad, and then I got to go to the gym. So if it's tied to a reason that's important to you, you're maybe a little bit more likely to stick with it. The second thing is they have realistic expectations. As in this study, it takes a long time. You're going to mess up. So it's not realistic to say I'm going to lose 50 pounds this month. It's realistic to say I'm going to take it off a couple pounds at a time. And let's just say up front, I'll probably mess it up a few times along the way, but I'm just going to keep going. The third thing is they seek out support and spend time with people who inspire and help them. And some people say they go out of their way to not spend time with people who don't. They work at achieving their goals, and they have a positive attitude about what they're doing. In other words, they don't look at eating a health-promoting diet and exercise as punishment for being overweight or for having a health issue. Instead, they feel pretty grateful that they know things to do to make life better for them and health better. And last but not least, they don't give up. They keep at it. And some of you are familiar with Dell's long struggle with losing weight, and he's just the poster child for getting back up, doing it again, saying, hey, I had a bad day, or I had a bad week, or something of that nature, but I'm determined to get to the other side of this, and then showing real progress. So it really doesn't matter how many times you might have tried and failed. What does matter is that you can start again today. You can make a decision to do it. Just do it. The old Nike slogan, I kind of love it. Maybe February is a better time to decide. First of all, it might feel a little more permanent. And let's face it, the choices are more likely to be made without benefit of cocktails to fuel some of your unrealistic expectations. So anyway, get started. Just do it today, and just take things a day at a time. Keep trying at it. Develop a strong why. Get a support system, and phenomenal things can happen if you stay with it. That's all for now, and as usual, pass this on to anybody who you think would enjoy watching it, and I'll be back to you Thursday with more news.